Welcome to State of Affairs. I'm Steve Adubato. We are coming to you from the Agnes Varis NJTV studio in Newark, New Jersey. We are introducing Brian Gragnolati, who is President and CEO, Atlantic Health System, and the Chair-elect of the American Hospital Association. Good to see you, Brian.
Good to see you. Thank you.
This is part of our ongoing conversations on the future of healthcare. Actually, we were in your office a while back talking about this issue, and you said, you know what? We need to have a comprehensive discussion around this, and you're absolutely right. And one of the issues you raised was access. What's the issue with access to healthcare?
You know, it's pretty interesting, and I think we saw it in this recent election. It's about access to insurance as well as access to care, and it's a big concern that everybody has.
Cross socioeconomic boundaries?
You know, it really is. You can parse out the insurance piece, but clearly the access to care piece is getting more and more concerning for everybody.
The other issue that you've raised, you've written about this, and by the way, Brian has a national role as well as being the CEO and president of Atlantic Health. You've talked about end-of-life issues. Now, New Jersey, and help me if I'm wrong, I know you will, we spend more at the end of life in terms of health care than any other state in the nation, correct?
We do. We do.
A, why? B, what do we need to do about it?
Yeah. I think it all starts with having conversations with families. That is the biggest element of this. I know in my personal situation with my parents, we talked about that. They wanted to live in their house as long as they could, and they wanted to be free of pain. And that guided our decision making. So we had advanced directives. We worked with their healthcare providers to make sure that they understood what my parents wanted. And that's really what needs to go on. And we have to have the structures, the processes, the system, and the time for our physicians to be able to have that
Was that
conversation.
atypical, Brian, you think, for most folks?
You know, I do. Particularly the folks that I've had an opportunity to care for in our organization. It is atypical, and we're working really hard at Atlantic to try to have those conversations to avoid, it's not just the cost of health care, but you know what it's like at the end of life.
Trust me, I have the conversation with my parents all the time.
Yeah.
Let me do, I wanted to give you a chance to do this. I was remiss. The footprint of Atlantic is?
So we serve half of New Jersey. It's about 4.9 million people. And last year we had an opportunity to care for over 780,000 of those individuals. By
the way, to fully disclose, Atlantic Health is one of several healthcare organizations, hospital systems, if you will, that underwrites the programming that we do here at the Caucus Educational Corporation. I'm curious about this. You've talked about the issue of technology, okay, and healthcare. Changing rapidly. Do we understand the implications of technology as he talks about, quote, the future of healthcare? Yeah.
The basic, at a very basic level, is how do we create your record so that anywhere you go, a provider can take a look at it.
Is that electronic medical record? Is that what we're talking about?
Electronic health record. If you think about the old days where you had piles of paper, we've now just invested multi-millions of dollars to connect all of our sites of care at Atlantic. And now I have my medical record on my smartphone. And that is the baseline for everything we do. But the other thing that we need to do is we need to connect people as consumers are connected with other things. Think about Amazon.
Yeah.
You know, think about how people interact with that. Think about making your appointments at 11 o'clock at night on your iPhone instead of having to make it a call. Those are the kinds of technologies that we're doing. And the other thing about technology is now that we have this clinical data and we can combine it with financial data, we can really look very differently at the effectiveness of care, the cost of care, how we need to distribute sites of care, and we're doing all of that at Atlantic, and it's very, very exciting.
Steve Adubato here. We're talking with Brian Gragnolati, who is the president and CEO, Atlantic Health System, and also chair-elect American Hospital Association. I'm curious about this. There is an initiative, and I want to get this right because there's some acronyms. What's TGen, by the way?
Yeah, so TGen is a collaborative that we're involved with that takes ideas in breakthrough cancer treatments and rolls them out in communities in conjunction with the companies that have developed them. It's very unique. It started out of Arizona. We're one of the early participants in that, and that's going to complement many of the other things we do in a really great oncology program that we have.
The conversation we've had before, Brian, and I want to try to share publicly with folks, is that you've said that there needs to be more partnership, more collaboration between hospitals and hospital systems. How realistic is that given the level of competition, dare I simply, or say this very simply, around beds?
Yeah. So, beds, if we're worried about beds, we're worried about the wrong thing. What we need to be worried about are our communities and the people that we have an opportunity to care for. And I'm actually very encouraged about some of the work that we're doing with other hospitals and health systems in this
Break that down
region.
a little bit.
Health Transformation Consortium, we talked about that when you were at my office. We brought together 6 other healthcare systems, so we basically have a network of physicians and facilities that runs from South Jersey all the way up to Bergen County. And within that system, we now have all of our employees of those systems being insured in a common way, because we self-insure all of our employees, and we want to lead by example. So that's an example of where you're working with others who you wouldn't have otherwise necessarily worked with on a common goal, which is to provide better access to health care at a lower cost for our own employees and their dependents.
The highly competitive, bifurcated, hey, you're you, we're us, here's the wall, doesn't work.
It doesn't work. Healthcare is a team sport. And it's not just between hospitals and health systems, it's between large physician groups, it's between insurers, and it's with drug companies. That's the only way we're going to solve this affordability problem in this country and meet the expectations that our patients have about easy access.
Before I let you out of here, by the way, this is part of our ongoing series, the Future of Healthcare. Actually, as we tape today, the Commissioner of the Department of Health, Dr. Ellenhall, is coming in to talk about this. We've had a whole range of hospital executives, insurance executives, advocates, a whole range of folks talk about this issue, including nurses, big part of this discussion, and physician leaders. The question of, I asked you about access, then you got affordability, but the cost issue you just raised, before we finish this up,
Sure.
Do you truly believe that we have the potential, realistically, to lower healthcare costs as it relates to its piece of the overall GNP of our nation?
Yes, we do and we must.
If
I
we
don't
do
think
not,
it's a choice.
Brian, if we do not,
If we do not, it's going to be regulated upon us through continued rate cuts, which are going to then decrease access to care and create an untenable situation. This week, there was an article in the Wall Street Journal about China. That's not where we want to be.
right? This is a must. Has
It's a
to be
must.
done.
It has to be done.
Brian Gragnolati, I want to thank you for joining us. We appreciate the conversation. We'll continue with you and your colleagues on the future of healthcare. Thank you, Brian.
Thank you.
Stay right there. We'll be right back right after this.